Medicos. Good day to all of you. Today I am going to discuss about two topics in this session, that is the Azygos system of veins in the first half, and then I will be talking about some of the features or the main aspects of the autonomic nervous system of the thoracic region. Okay, so this will be our concluding class of the thorax, and after that we will be actually passing on to a new region. Okay, so coming to the Azygos system of veins. So in the previous session I have discussed in detail about the posterior mediastinum, the structures present in the posterior mediastinum. So Azygos system of veins is very much a part of the posterior mediastinum. So it is actually a longitudinal or vertical structure. At the same time, it also comes as a part of the transverse structure, especially the termination of these two veins in the posterior mediastinum. They run transversely to actually end in the Azygos vein. Now, Azygos system of veins comprises of mainly the three veins: the Azygos vein, the Hemiazygos vein, and the Accessory Hemiazygos vein. So this is the main Azygos vein. Then you have the Hemiazygos vein here, and this is the Accessory Hemiazygos vein. The term Azygos means unpaired. So you do not have a pair of veins. It is single. It does not have a counterpart. That is why it is termed as the Azygos vein. Okay. Now, mainly the Azygos vein, the Hemiazygos vein, and the Accessory Hemiazygos vein, they drain mainly your thoracic wall, the walls of the thorax, and then your upper part of the lumbar region. They drain your thoracic wall and upper part of the lumbar region. Now, why actually the Azygos system of veins gains importance is because it serves as a collateral channel, or a channel which connects the superior and the inferior vena cava. So in case of any obstruction, then naturally what happens is blood can reach the right atrium either through the superior vena cava or through the inferior vena cava. Okay, so now let us discuss about the Azygos vein first, in the Azygos system of veins. Okay, so as it is a content of the posterior abdominal wall, this Azygos system of veins, mainly the Azygos vein, is actually formed or originates in the posterior abdominal wall. Only then it enters the thorax. Only then it enters the thorax. It is mainly formed by the union of subcostal vein and ascending lumbar vein. Okay, so it is by the union of the subcostal vein, the 12th vein. Here subcostal vein is labeled for you on the left side, but right side, union of the subcostal vein and the ascending lumbar veins. So here you are able to see these are the lumbar veins, the four lumbar veins which drain your posterior abdominal wall, the lumbar region, posterior part of the lumbar region, and they are united. This channel which connects these lumbar veins are actually called as the ascending lumbar veins. Okay, so it's formed by the vertical anastomosis that connects the lumbar veins. Usually you have the four lumbar veins, first, second, third and fourth lumbar veins. Along with this, the subcostal vein unites and it forms the lumbar Azygos vein. Okay, this is actually called as the lumbar Azygos vein. So lumbar Azygos vein is nothing but the abdominal part of the Azygos vein. the abdominal part of the azygos vein is actually called as the lumbar azygos vein, and the formation is actually variable, as we have discussed in so many classes regarding the veins. Veins are more prone for variations, okay, and any variations gains importance only when there is an interference in its function, okay. So the subcostal vein might drain separately. That is one common type of variation, instead of joining with the ascending lumbar vein. So now after its formation in the abdomen, posterior abdominal wall as the lumbar azygos, then it actually enters the thorax, okay. It enters the thorax by passing through the aortic opening of the diaphragm, okay. So here the diaphragm is not shown and the aorta also has been removed. We are able to see only the abdominal aorta. Thoracic part of aorta is removed, but along with the aortic opening at the level of T12 vertebra, the opening in the diaphragm for the thoracic aorta, descending thoracic aorta, the lumbar azygos vein or the azygos vein, it ascends through the aortic opening, and afterwards what happens is it is seen ascending in the posterior mediastinum, okay. In the posterior mediastinum you are able to see it ascends in front of the vertebra, the lower 8 thoracic vertebra, intervertebral discs and the anterior longitudinal ligaments are actually present behind the trunk of the azygos vein. At the level of T4, 4th thoracic vertebra, sternal angle, at the level, not exactly at the sternal angle, at the level of sternal angle behind, it arches over the root of right lung. It arches, you are able to see these are the lung root structures, right lung root structures, okay. You have the principal bronchus artery and the 2 pulmonary veins, superior and inferior pulmonary veins. So it arches over the root of right lung, and then what happens is it opens into the superior vena cava at the level of the second costal cartilage, okay. So terminates into the superior vena cava at the level of the second costal cartilage. After that the superior vena cava pierces the fibrous pericardium and then opens into the right atrium, okay. At T3 it pierces the fibrous pericardium and then opens into the right atrium. So before piercing, what happens? The superior vena cava receives the termination of the azygos vein. So that is the course of the azygos vein. Now coming to the relations of the azygos vein. So here you are able to see the azygos vein. In front you have the esophagus. In front you have the esophagus. Behind, as I told you, the lower 8 thoracic vertebra and the posterior intercostal arteries, especially the right posterior intercostal arteries, because your descending thoracic aorta will be present here, and the posterior intercostal arteries which are arising from the aorta has to cross the midline and go to the right side of the intercostal spaces. So the thoracic vertebra and the posterior, right posterior intercostal arteries all passes behind the azygos vein. To the right side it will be related to the right lung and the pleura, and you know that the mediastinal surface of the right lung there is an impression for the arch of azygos vein above the hilum. Above the hilum on the mediastinal surface of the right lung you have the impression for the arch of azygos vein. Then it is also related to the greater splanchnic nerve. Greater splanchnic nerve is actually a branch, medial branch from the sympathetic trunk. I will come to it later in the autonomic nervous system of the thorax. To the right side these are the relations. To the left, thoracic duct, esophagus and the descending thoracic aorta. So these will be the left side relations. Okay. So these are some of the relations of the azygos vein. Now coming to the most important part is the tributaries of the azygos vein. So mainly it receives the posterior intercostal veins. Posterior intercostal veins. First vein actually does not drain into the azygos vein. It drains directly into the brachiocephalic vein. The second, third and fourth posterior intercostal vein unites to form a single superior intercostal vein. See, the second, third and the fourth unites to form the superior intercostal vein. So superior intercostal vein is one of the tributary of the azygos vein. Then after that 5, 6, 7, 8, 9, 10 and 11. 5th to 11th, all this 5th to 11th drain separately or individually into the azygos vein. Okay, so intercostal vein, 5th to 11th right posterior intercostal veins. Then it also receives the termination of the hemiazygos vein. You are able to see here, that is the hemiazygos vein. Definitely at the level of T8, hemiazygos vein and also the accessory hemiazygos vein, both actually again terminate into the azygos vein at the level of 8th thoracic vertebra. So they form the transverse structure, these two, the posterior mediastinum, and even the deviation of thoracic duct at the level of T4 from the right side to left side also is one of the transverse structure in the posterior mediastinum. So superior intercostal vein, 5th to 11th right posterior intercostal vein, hemiazygos vein, accessory hemiazygos vein. Then you have the right subcostal vein, that is the formative veins. Of course your ascending lumbar vein. Then you have bronchial veins and some veins from the esophagus, mediastinal and pericardium. Esophageal, mediastinal and pericardial veins also drains, some of the veins drains into this azygos vein. And as I told you, one of the formative vein is the right ascending lumbar vein. So these are the tributaries of the azygos vein. Now coming to the hemiazygos vein, next we are going to discuss about the hemiazygos vein. It is present on the left side and it corresponds to the lower half of the azygos vein. Corresponds to the lower half of the azygos vein, or it can be considered as a mirror image of the lower half of the azygos vein. So formation is again similar to the azygos vein, but this is taking place on the left side. So formed by the union of the left ascending lumbar veins. So here you are able to see the lumbar veins. They are anastomosis, forming a vertical anastomosis, and that is the ascending lumbar vein, and that will unite with the subcostal vein to form the hemiazygos vein. So that enters the thorax not through the aortic opening but pierces the left crus of the diaphragm. So crus of the diaphragm is nothing but the vertebral origin of the diaphragm. Diaphragm origins by the attachment of the diaphragm to the vertebra, right crus and the left crus. So it pierces the left crus of the diaphragm, ascends along the left side of the vertebra, and at the level of T8 it turns towards the right side behind your esophagus, descending thoracic aorta and thoracic duct, and terminates into the azygos vein. So at the level of T8 it turns right side and terminates into the azygos vein. So the tributaries of the hemiazygos vein, you are able to see the 9th, 10th and 11th posterior intercostal veins. 9th to 11th posterior intercostal veins, subcostal vein, left ascending lumbar veins, and small esophageal and mediastinal veins. So these are the tributaries. Mainly drains the 9th to 11th posterior intercostal spaces, and the formative tributaries are the left subcostal and the left ascending lumbar vein. Next is the accessory hemiazygos vein. It can be again considered as the superior hemiazygos, whereas the hemiazygos is actually considered as the inferior hemiazygos. It is considered as superior hemiazygos, and it is a mirror image of the upper half of the azygos vein, while hemiazygos is the mirror image of lower part of the azygos. This accessory hemiazygos is considered as the mirror image of the upper half of the hemiazygos vein. So it begins at the medial side of the intercostal spaces posteriorly at the level of 4th or 5th. Okay, at the level of 4th or 5th it originates and descends along the left side of the vertebral column, to the left of the vertebral column. It descends, not ascends, it descends, and then again it turns towards the right at the level of T8 to terminate into the azygos vein. Okay, so it passes posterior to the esophagus, thoracic duct, and descending thoracic aorta. And what is present posterior to it is the posterior intercostal vessels, and sides of the bodies of vertebra are all present posterior to it. So the tributaries of accessory hemiazygos veins are, so 5th to 8th posterior intercostal veins. Here left side, first one goes to the brachiocephalic vein, left brachiocephalic vein. Second, third and fourth form superior intercostal veins, but that also drains into the brachiocephalic vein, left brachiocephalic vein. Only the 5th to 8th drains into the accessory hemiazygos vein. Occasionally, sometimes the left bronchial veins also drains into the accessory hemiazygos vein. And the accessory hemiazygos vein, ultimately what happens is, at the level of T8 turns towards the right side and drains into the azygos vein. Okay. Now I told you it serves as a main collateral channel, mainly in the obstruction of the superior vena cava. Mainly the obstruction of the superior vena cava. Now let us assume if the superior vena cava is obstructed after the termination of the azygos vein. After the termination. So that means blood cannot reach the right atrium from the superior vena cava. Then naturally what happens is, blood from the brachiocephalic veins, they will drain via the internal thoracic vein, which is again draining into the brachiocephalic vein. Internal thoracic vein. So the internal thoracic vein receives anterior intercostal veins. The main trunk of the internal thoracic vein receives anterior intercostal veins, and the remaining lower space for the first 6 spaces, and the remaining spaces, it is actually by the one of the terminal branches of the internal thoracic vein. Okay, musculophrenic. So what happens is, through the anterior intercostal veins anastomose with the posterior intercostal veins. So they will reach the posterior intercostal veins, and through the posterior intercostal veins they will reach the azygos vein, and from them they will reach the inferior vena cava, and through the inferior vena cava blood will be drained into the right atrium. Okay, so through the internal thoracic anterior intercostal they anastomose with the posterior intercostal, and naturally they reach the azygos vein, through which they reach the inferior vena cava. Now suppose what happens is if it is blocked, the SVC is blocked before the termination of the azygos vein, I told you. Now after the termination of azygos vein, now suppose after the termination of azygos vein, if it is blocked, then blood can very easily through the azygos vein. Same way what happens is, it can reach via the inferior vena cava. Okay, after the termination means all the blood which is coming from the upper half of your head, neck and upper limb will go via the azygos vein. From the azygos vein it will reach the inferior vena cava. Okay. Prior to termination of Azygos vein, if there is obstruction, it will go to the internal thoracic, anterior intercostal, post intercostal. From there, it will reach the Azygos vein. So that is the how the path taken by the venous blood in the obstruction of the superior vena cava. So that is about the Azygos system of veins. Now I will pass on to the next part of the lecture, which is the autonomic nervous system of thorax. You all know that the autonomic nervous system of thorax consists of the sympathetic part and the parasympathetic part. The parasympathetic part is mainly taken care of by the vagus nerve. Okay, and our whole body, the parasympathetic part is actually called as the craniosacral outflow. So cranium means in the upper part you have the parasympathetic, which is by the cranial nerves, and then you have parasympathetic component only in the sacral segments of the spinal cord. The thoracolumbar outflow is actually called as the sympathetic component. Now we will see the sympathetic component. It is mainly formed by the sympathetic chain, and we have a series of ganglia along the sympathetic chain. You see, these are actually the sympathetic ganglia. So there are 11 pairs of sympathetic ganglia. Okay, so usually 12 for corresponding spinal nerve. You should have 12 ganglia, but 11. Why? Because first one fuses with the cervical sympathetic ganglia, inferior cervical sympathetic ganglia, to form the stellate ganglia. In that case, you will have 11. Sometimes, rarely, even the second thoracic ganglia will fuse. In that case, you will have only 10 sympathetic ganglia. Okay. So this is called as a thoracic part of the sympathetic chain, which is seen on either sides of the vertebral column, and it is related to the head of the ribs. If they continue downwards into the lumbar as the lumbar sympathetic chain, and finally they actually fuse in front of the last piece of sacrum or coccyx as the ganglion impar. So there you don't have two ganglia. In the midline only one ganglia, it is fused. So the sympathetic chain has got a cervical sympathetic chain where you have only 3 ganglia, superior, middle and inferior cervical ganglia. Then you have a series of thoracic sympathetic ganglia. They are 11 in number because the first one fuses with the inferior cervical ganglia to form the stellate ganglia. Okay. Now each of the ganglia, you are able to see what happens is they are present closely to the head of the ribs and at the sides of the vertebral bodies, which I already told you. Now each of the sympathetic ganglia, you are able to see, is connected to the corresponding spinal nerve by 2. They are actually called as the gray and white rami communicants. Okay, they are actually called as the gray and white rami communicants. The gray and the white rami communicants are actually called as the preganglionic fibers. So if this is the ganglion, fibers coming to the ganglion from the spinal cord is actually called as the preganglionic fibers. Fibers leaving from the ganglion is actually called as the postganglionic fibers. So it is connected by the preganglionic and postganglionic fibers by the gray and white rami communicants. So white rami communicants is actually preganglionic fibers. The preganglionic fibers arise from the lateral horn cells of the spinal cord. See, the gray matter of the spinal cord has got a posterior horn and an anterior horn. This is anterior horn and a posterior horn. But in the thoracic part of the spinal cord, in the thoracic segments of the spinal cord, you have one more lateral extension, which is actually called as the lateral horn cells of the spinal cord. So from there, the preganglionic fibers arise from the white rami communicants, and what happens is they might terminate in different ways, 3 different ways. One is they will come and relay in the ganglion. That is one way. The other way is they might ascend above and below to the upper and lower ganglia. So one preganglionic fibers is thought to connect many sympathetic ganglia, to traverse many, so thereby the effect is actually widespread. So they might relay in the same ganglia, they might ascend or descend into the above and below ganglia. Sometimes they might also go via the collateral ganglia. So collateral ganglia are actually present around the blood vessels. Along the celiac trunk, it is present celiac ganglia. Same way you also have aortico-renal ganglia. There they also form plexus, aortic plexus and renal plexus, celiac plexus. Okay, celiac ganglia. They might actually bypass these sympathetic ganglia and go to the collateral ganglia. Okay. Postganglionic fibers. Postganglionic fibers. Okay. They actually arise from the ganglia, and from there what happens is they might go via the ventral rami of the spinal cord and relay in the lateral horn cells. Okay. So they might pass via the dorsal root ganglia and then they might also relay. Okay. Now, postganglionic fibers are mainly to the body wall as the pseudomotor, paleomotor. Okay, they are actually pseudomotor, they are actually vasomotor, and they are actually paleomotor. So mainly vasomotor, you know, to the blood vessels, motor to the blood vessels constriction. So paleomotor to the erector pyloric muscles. Okay, they are actually pseudomotor, paleomotor and vasomotor. The sympathetic component mainly consists of a motor component and a sensory component. So motor component mainly, as I told you, pseudomotor, paleomotor and vasomotor, and also to the motor to the viscera, to the heart, lung and all those things, to the abdominal viscera they exert. The sensory component is they convey pain sensations. So the pain sensations from the viscera, they are called as afferent sympathetic nerves. Afferent sympathetic nerves, they ascend through the ganglia, and from there through the dorsal root ganglia, peripheral process, they relay here. Then from the central process, they might again come to the lateral horn cells of the spinal cord. So afferent sympathetic fibers mainly carries the pain sensations. Okay. Now, what happens is the nerve endings of the sympathetic fibers, they release noradrenaline. So they are called as adrenergic fibers. They mainly increase the heart rate. They constrict the peripheral blood vessels. They increase the blood supply to the brain muscles. They dilate your pupils. They dilate your palpebral fissure. They increase your blood vessels. They increase your blood sugar levels. So that is why in case of fright and flight. But actually to the sweat glands, they don't release noradrenaline. Instead, they are actually acetylcholine. That is the only exception of the sympathetic fibers where they are cholinergic in nature. The neurotransmitter is acetylcholine to the sweat glands. Okay. So that is how they are connected. Now, the branches from the sympathetic trunk, they give rise to esophagus, forming esophageal plexus. Pulmonary plexus, they are formed in front of the bronchus and behind the bronchus. Okay, they are responsible for the formation of pulmonary plexus. They take part in the formation of cardiac plexus, esophageal branches. So cardiac plexus, mainly the deep cardiac plexus, you are able to see here through its cardiac branches. Then the medial branches of the sympathetic trunk is actually called, here you are able to see the branches which are arising medially, they are actually called as the greater splanchnic, lesser splanchnic and least splanchnic nerves. The upper ganglia, first thoracic to fourth thoracic sympathetic ganglion, takes part in formation of cardiac, pulmonary, and esophageal branches, but the lower one, 5th to 9th, forms the greater splanchnic nerves. The greater splanchnic nerves, what happens, their offshoot only gives rise to the celiac plexus, and they might also go to the aortic plexus. Lesser splanchnic nerves goes to the aortico-renal plexus. Lowest splanchnic nerve is a very small nerve from the 12th sympathetic chain, the last one. They also go to the renal ganglia, or sometimes it might be absent. Okay, so that is the branches, the medial branches of the thoracic sympathetic chain is actually called as the greater, lesser and least splanchnic nerves. You also have medial branches from the lumbar part of the sympathetic chain. They are called as lumbar splanchnic nerves. Okay, so you are able to see the sympathetic chain. So the upper part, 1st to 4, are giving rise to esophageal branches, pulmonary plexus, cardiac branches. The lower, from 5th to 9th, 5 to 9 form the greater splanchnic nerve, 10 and 11 will form the lesser, and the last one will form the least splanchnic nerves. Here it is labeled as greater splanchnic, lesser splanchnic nerves and all those things. See, they are going to the celiac ganglia, aortico-renal ganglia. Now, superficial cardiac plexus, because nerve supply to the heart, so naturally a small description of the superficial cardiac plexus. It is present below the arch of aorta and above the bifurcation of the pulmonary artery, and the main branches are superior cervical cardiac branch. Actually, this is from the cervical part of the sympathetic chain, superior cervical cardiac branch from the cervical sympathetic chain. Inferior cervical cardiac branch from the left vagus. Inferior cervical cardiac branch from the left vagus, and from them these plexus they give branches to the pulmonary, coronary and deep cardiac plexus. So actually the superficial cardiac plexus, the thoracic part of sympathetic chain is not giving any contribution. Coming to the deep cardiac plexus, it is seen at the bifurcation of the trachea. So in front of the bifurcation of the trachea, you are able to see the deep cardiac plexus. So it is mainly by cardiac branches of the cervical sympathetic chain, except the left superior, which is given to the superficial cardiac plexus, upper cervical cardiac branch, that one. Apart from that, all the cardiac branches from the cervical sympathetic chain, cardiac branches of the thoracic, first 4, they take part in the deep cardiac plexus. From the first 1, 2, 3, 4 thoracic sympathetic ganglia, and branches from the right vagus, cardiac branches from the right vagus, from the left recurrent laryngeal nerve, both the left and right recurrent laryngeal nerves. This is the parasympathetic component. Right vagus and the referent laryngeal nerves of right and left side are actually the parasympathetic component. The sympathetic component is from the cardiac branches of the upper 4 thoracic sympathetic ganglia, and the cervical cardiac branches from the cervical sympathetic ganglia. So from here it is distributed again to the superficial cardiac plexus and right and left pulmonary plexus, and also to the right and left coronary plexus. So that is about the superficial cardiac plexus, and then the deep cardiac plexus. And to the left and right atrium also. So here you are able to see the formation mainly by the thoracic cardiac branches of the vagus and sympathetic. From the sympathetic tongue they are giving cervical cardiac branches. They all take part in the formation of the deep cardiac plexus. Coronary plexus, they are again 2 in number, right and left. They are present along the right and left coronary artery. So they receive branches from the cardiac plexus. So right coronary plexus is around the trunk of right coronary artery. Left coronary plexus is along the left coronary artery. So sympathetic fibers, they increase the heart rate and cause dilatation of the coronary vessels. So increase the blood supply to the heart. That is the main function, whereas parasympathetic vagus decreases the heart rate. Pulmonary plexus, so anterior and posterior to the hilum of the lung, mainly you are able to see here, this is the pulmonary plexus, and their extensions again branches from the cardiac plexus, the deep cardiac plexus. So anterior plexus is formed in front by the vagus superficial cardiac, and posterior plexus is mainly formed by the vagus, the deep cardiac plexus, and sympathetic. So sympathetic is mainly giving to the posterior pulmonary plexus, to the deep cardiac plexus, and posterior plexus is larger as compared to the anterior, and the left recurrent laryngeal nerve contributes for the parasympathetic part. So they are bronchodilators, sympathetic fibers, whereas the parasympathetic are bronchoconstrictors and increases the secretion because they are secretomotor. Any parasympathetic, they increase the secretions. Okay. Finally, the esophageal plexus. So in the lower part of the esophagus, you can see the esophageal plexus is formed by esophageal branches of the thoracic sympathetic ganglia. Okay, first 1 to 4 we have seen cardiac branches, pulmonary branches, and esophageal branches. And by the both vagi nerve, from these plexus onwards, the vagus nerve cannot be called as right and left. Instead, it forms the anterior and posterior vagal trunk. Again, the posterior vagal trunk is larger than the anterior vagal trunk. And the anterior vagal trunk has got a celiac as well as the hepatic component. The posterior vagal trunk has got again a celiac component. Gastric as well as the celiac component, here gastric and the hepatic components. Sympathetic inhibits peristalsis, but parasympathetic stimulates the peristalsis and closes all these sphincters. Okay, so that is about the esophageal plexus. Now, thoracosympathectomy is done mainly to relieve pain, especially in cardiac pain, or to control the blood pressure. Okay. Same way, vagal trunks, anterior and posterior vagal trunk, posterior selective vagotomy is actually done to control the peptic ulcers. Okay. So in uncontrolled cases, in chronic peptic ulcers, selective vagotomy is performed. So that is the posterior vagal trunk you are able to see here, which is larger than the anterior vagal trunk. Esophageal plexus, which is formed by the esophageal branches. Okay, and also by the vagus nerve. So thank you very much for your patient listening to this class, and with this session we have completed about the thorax. So thorax is a very small chapter as compared to the abdomen, pelvis or head and neck, but it has equal importance as that of the abdomen, pelvis or head and neck, because you all know the vital organs of respiration and the circulation are actually present here. So thank you very much. We will meet again in one more class.